Greetings from Washington, D.C. This is Peter Thomas, the General Counsel of NAAOP. Well, it's been an incredible, historic month politically, and now we hunker down and wait for the results of the election to see who will control the Senate, the House, and the executive branch. But in the meantime, NAAOP has been hard at work. July has been an exceedingly busy month, especially for Taylor Haines, the 2024 Breece Fellow. Taylor wrapped up her fellowship just today, and we are very grateful for all she's done for NAAOP and for the O&P profession and the patients to whom the profession serves. Just last week, on the 16th of July, Taylor was instrumental in helping organize the annual Congressional Virtual Fly-In for the NAAOP board and some of the members. We had about 13 people participate, including some of the former Breece Fellows. We met with over 35 offices on both the House and Senate side, and we advocated on one issue, the Medicare O&P Patient-Centered Care Act. We're trying to get as many co-sponsors onto that bill, and we're trying to move that bill in both the House Energy and Commerce Committee and in the Senate Finance Committee. In fact, we met with Senator Wyden's staff, his personal health staff, and because Taylor is a patient care coordinator for the Hanger organization in Oregon, the state that Ron Wyden represents, we had a very good meeting there. In fact, he invited us back to meet with the committee staff. In the meantime, the next morning, we did attend a breakfast for Senator Wyden. Hanger supported Taylor's participation in that fundraising breakfast. I participated on behalf of NAAOP and the O&P Alliance, and Joe McTernan went as well and participated on behalf of AOPA. We all made a spirited argument for the O&P Patient-Centered Care Act to try to get Senator Wyden focused on the bill in the closing months of the 118th Congress. I think we made some real strides. He asked us to meet with his committee staff the following day, which we did. We asked them to assist with trying to get the Congressional Budget Office to score the bill, a necessary step in moving the bill forward. We also asked him to speak with CMS to try to get what they call technical assistance on the bill, to see if we can have CMS weigh in on what they think of the bill's 3 provisions. Ultimately, we made some real progress with the fly-in and with these Wyden contacts, and it's another example of the O&P organizations working together to try to advance and move forward important legislation and important policies. Last week, we also learned of a very big policy victory that we've been working together on for several years, that of the Medicare coverage for K2 amputees with respect to microprocessor prosthetic knees, fluid and pneumatic knees as well. What a great new policy that will allow many new Medicare beneficiaries who are less functional than being kind of unlimited community ambulators to be able to take advantage of microprocessor technology to reduce the risk of falls, the fear of falling, and ultimately improve function. It's a great step forward, wonderful news to accompany some of the other big advances in Medicare coverage that have been announced over the last 18 months to 2 years. And we felt we needed to promote this as much as possible. NAAOP held a webinar talking about all of these coverage changes, improvements to the Medicare program on the 23rd of July. And if you missed that webinar, we do hope that you'll go to our website, download it, and take an hour and 10 minutes and listen to it, including the Q&A session. The webinar was really instructive. We had great participation, and it's all on the website at www.naaop.org. So with the passing of our 7th Breece Fellowship now being concluded, and Taylor returning to her duties at the Hanger organization in Oregon, we will return to doing our work in Washington, continuing our work and doing all we can to advance O&P policy on behalf of providers and patients. Thanks so very much for your support of NAAOP.